The World Health Organization has raised an alarm over Mpox outbreak in Africa, declaring it a public health emergency of international concern. For the second time in 2 years, the World Health Body has declared an Mpox health emergency. The WHO decision follows an outbreak of the viral infection in the Democratic Republic of Congo that has spread to its neighbouring countries. Now the health body fears the spread of Mpox to countries outside Africa.
Last week, I announced that I was convening an emergency committee under the international health regulations to evaluate the upsurge of Mpox in the Democratic Republic of the Congo and other countries in Africa. Today, the emergency committee met and advised me that, in its view, the situation constitutes a public health emergency of international concern. I have accepted that advice. It's clear that a coordinated international response is essential to stop these outbreaks and save lives. A public health emergency of international concern is the highest level of alarm under international health law.
Public Health Emergency of International Concern, or PHEIC status, is the WHO's highest level of alert. It aims to accelerate research, funding and international public health measures and cooperation to contain the disease. The WHO Director General, Tedros Ghebreyesus, said that the world body has released $1.5 million in contingency funds and plans to release more in the coming days. WHO's response plan would need an initial $15 million. Earlier this week, Africa's top public health body declared an Mpox emergency for the continent after warning that the viral infection was spreading at an alarming rate, with over 17,000 suspected cases and more than 500 deaths, mainly among children in the Democratic Republic of Congo. Let's break down what we know about Mpox and the current outbreak so far. First things first, what is Mpox? It is an infectious disease caused by a virus. The symptoms include fever, chills and muscle aches, and are typically followed by a rash that starts as raised spots, which turn into blisters filled with fluid, and these eventually form scabs. There are broadly two different types known as clades. Clade 1 was once known as the Congo Basin clade, and Clade 2 as the West African clade. Both can be fatal, but Clade 1 has had a higher death rate. The African CDC says 34 countries in Africa are either reporting infections or are considered at high risk. At least 12 countries have reported cases so far, including the DRC, which has more than 90% of the cases. Some countries like Burundi, Kenya and Rwanda have reported Mpox cases for the first time. Like I mentioned, the most severe outbreak is in the DRC, which has over 90% of the cases in Africa. 511 Mpox deaths have been reported this year. Cases of a deadlier strain of Mpox have been confirmed in 4 countries. A new offshoot of Clade 1, which is called Clade 1b, has been detected in East DRC. It has also been confirmed in Kenya, Rwanda and Uganda. Earlier, Clade 1 typically spread by people eating infected bushmeat, but Clade 1b is spreading person to person, often via sexual contact. It is also spreading through other physical and face-to-face contact, or via contaminated bedding or towels. There are vaccines, but there are issues with access. Africa CDC says it needs 10 million doses, but only 200,000 are available. Authorities say a lack of treatments and diagnostics is hampering the response. Plans for vaccination programs are still under review, but other plans, including tracing and vaccinating contacts of cases, could be launched.
Climate change is on our doorstep. It's time for a revolution to take root. And it starts with 1.4 billion Indians. It starts with one tree for humanity, one tree for Mother Earth, one tree for our future. Project One Tree. a News 18 network initiative.
On this today, the T20 World Cup bandwagon has moved across to the West Indies.